Mr. Santiago T.K. De Leon Jr., and Ms. Sharian A. Ahari, our dearest nutrition and diet therapy instructors.
Today, we will be presenting our case entitled A Case Study on Cold Diet for Dental Caries. I am Kair Alharti Masire, together with
Snowwinds S. Alfafara,
Vilazar B. Apalacio,
Fatima Claudine K. Jul,
Shaira A. Kabugatan,
Eunice Giana Emmanuel,
Monica Rain H. Salimbulong.
So dental caries is a disease that starts in the dental biofilm when sugar exposure causes a shift toward acid-producing bacteria. Now, these acids dissolve the enamel and deeper tooth layers, eventually forming a cavity. Because it requires both bacteria and fermentable sugars, caries is considered a dietary microbial condition. And behavioral factors and low fluoride also increase the risk. Symptoms. Dental caries causes increasing pain and sensitivity, especially as decay approaches the pulp. If untreated, infection may lead to abscesses and rarely life-threatening complications. Oral pain is abnormal and indicates disease. In children, caries affects basic functions, and in all ages, untreated decay leads to tooth destruction and loss. Causes. For causes, dental caries begin when oral bacteria metabolize sugar and starches, producing acids that form plaque. Without proper brushing and flossing, these acids gradually dissolve the enamel and create cavities. Risk factors. Early childhood caries result from several combined factors. We have low maternal education, low income, frequent sugary intake, and poor oral hygiene increase risk. Prolonged nighttime breastfeeding or bottle feeding and biological factors like Streptococcus mutans, colonization, and enamel defects also contribute. Caries in young children is therefore multifactorial. Complications. If untreated, dental caries can spread and cause serious infections such as Ludwig's angina, airway obstruction, or sepsis. They may also lead to local problems like abscesses, granulomas, cysts, cellulitis, and bone infections. Next, epidemiology. Now, dental caries are widespread worldwide and especially affect low-income groups. In the Philippines, 72% of our population, many of them children, have tooth decay, highlighting its major impact on daily functioning and the public health. Finally, we have the pathophysiology. Dental caries occur when frequent sugar intake promotes acid-producing bacteria that lowers the pH of the dental biofilm. Now, these acids remove minerals from enamel faster than saliva, and fluoride can repair it, first causing a white spot lesion and eventually an irreversible cavity.
Diet plays a major role in supporting overall health, and improper eating habits can contribute to illness or complications. When the body is recovering, especially after procedures like surgery, dietary adjustments are often necessary. In these cases, a cold diet is commonly recommended because it helps reduce pain, inflammation, and discomfort during the healing process. Objectives. At the end of this case study, the nursing students will be able to conduct a comprehensive assessment of a patient who had undergone tooth extraction, emphasizing the need for a cold liquid diet. Observe for patient privacy and confidentiality while acquiring accurate information from the client. Calculate necessary dietary computations such as desirable body weight, body mass index, total energy requirement, and percentage distribution. Present a sample menu for the client to follow for the next 24 to 48 hours. Conduct a healthy chain to enforce the importance of following a cold liquid diet. Prepare the prescribed cold liquid diet to supplement the total energy requirement of the client. This study aims to show the importance of a cold liquid diet for clients with post-surgical tooth extraction. Specifically, to provide nutrition in a gentle form, to minimize pain on the extracted site, to promote rapid wound healing, to maintain hydration, and to reinforce knowledge on the proper dietary requirements, specifically the right nutrient and calorie intake following a cold liquid diet. A cold liquid diet includes chilled, non-chewable foods that ease discomfort and after procedures which provide basic nutrients and limit digestive strain during healing. A cold diet helps soothe irritation, ease pain, and support hydration during recovery from infections, fevers, or dental and throat procedures. Cooling foods lower heat but should be eaten in moderation to avoid digestive issues. Balance them with warming foods and adjust based on your body's response. A cold diet is safe, but overusing very cold or low nutrient foods can cause discomfort or slow healing. Choose nutrient-rich options and return to regular foods gradually.
We are going to start with the patient's profile. Our patient is Miss GL, her initials. She is 19 years old, a female, single with a height of 144 cm and weight of 47 kilograms, giving her a BMI of 22.66, which is within the normal range. So her chief complaint is she reports experiencing a toothache for 1 week, with pain radiating to her head, causing headaches. The pain worsens at night and is triggered by hot and cold foods. She initially self-medicated with Saridon, which provided temporary relief, but the pain eventually persisted, prompting a visit to the dentist, where she was advised to undergo tooth extraction. So next, we have the client's medical history. The patient has no current illnesses. Her last notable illness was chickenpox in year 2018. She has no allergies, no past surgeries, and no hospitalization. So her physical state, according to the patient, hindi makafunction, especially at night. Mainit at malamig na foods nagtitrigger. This highlights significant discomfort affecting her sleep and daily functioning. So we have here the family history of the client. So her father has hypertension, diabetes, and suffered a myocardial infarction in July. Both brothers have asthma or is asthmatic, and one had dengue in 2015. This indicates a family background of chronic and acute conditions. So next is the socio-economic background of our client. She is a Zamboangueña living in a dormitory as a college student. She follows the dietary practices of Members Church of God International, or the MCGI, avoiding halal and bloody foods. Her family supports her through weekly allowances and groceries.
For the client's food likes and dislikes, so the client enjoys sweet foods like chocolate chip cookies and savory dishes, such as Bicol Express and sisig. She dislikes most vegetables, except squash, radish, and potato. So for her 24-hour food recall, so the client did not eat breakfast. For her AM snack, she ate a fudgy bar and a Cloud9 bar. For lunch, she had egg drop soup with mommy noodles and 1 cup of boiled rice. For PM snacks, she consumed ice cream and ate chocolate 9. For her dinner, she ate 1 cup of boiled rice with fried chicken and a chicken fillet burger and drank a bottle of Nestea iced tea. For her bedtime snacks, she had 2 boiled Penoy eggs and a pack of chicharon and a mango juice. So for the meal frequency and schedule, the client usually eats 2 meals and 3 snacks per day. Breakfast is between 7 to 8 a.m. and lunch is at 12 p.m. and the dinner between 6 to 7 p.m. with snacks in between. So for the cooking facilities, so the client prepares her own meals, though her cousin sometimes cooks, and she has access to a kitchen but mainly uses an electric cooker in her room. So she often eats in fast food such as Jollibee, McDonald's, or Mang Inasal, and occasionally visits cafes. So the client's food budget, client spends around 2,500 pesos per week on groceries and 200 pesos to 300 pesos on daily on food during weekdays and Saturdays. So the client also takes potency daily, usually at night, because she often forgets it in the morning. So for the past diet restrictions of the client, so she has no past diet restrictions, and she was able to eat a regular diet without limitations and has no known food allergies or medical conditions requiring dietary changes. So for the nutritional knowledge, the client gets her nutritional information mainly from TikTok, family members, and peers. Her mother encourages her to take supplements due to frequent stomatitis. So for the dietary needs in the hospital, so the client's likes and dislikes, so she prefers cold foods like ice cream and halo-halo, and soft foods such as soup and lugaw. She dislikes hard and crunchy foods and avoids hot foods and drinks. So for the dietary prescription, so she is on a cold and soft diet to reduce irritation and promote healing. She must also avoid hot foods and straws to protect the mouth tissues. So for the client's appetite, so her appetite was low before the extraction due to difficulty of chewing, but it has improved since the procedure. So next, a physical handicap. So the client has no physical limitations and can feed herself independently. So for the food tolerance, the coffee sometimes upsets her stomach but not always. And lastly, for the need for dietary instruction. So she was advised to take her prescribed medications consistently to support healing.
So for the nutrition care process, so nutrition problem number 1 is nutritional. So for the nutrition assessment, the client skips breakfast, eats only 2 meals a day, and relies on frequent sweet snacks. She has high fast food intake, low vegetable intake, and prefers soft, sweet foods because of dental pain. Her appetite is reduced. She previously followed a soft diet after extraction, and her current intake does not meet nutrient needs. For the diagnosis, acute pain related to tooth decay from frequent fast food and sweet intake as evidenced by discomfort while chewing. For the intervention, provide soft, easy to chew, and nutrient-dense foods, and encourage small, frequent meals and regular breakfast. Give tailored nutrition education and coordinate with dentists for diet progression, and monitor daily food choices. For monitoring and evaluation, goals are greater than or equal to 3 meals a day, 75 to 100% nutrient needs, breakfast at least 5 times a week, and decreased chewing pain, and a shift toward more balanced meals. For nutrition problem number 2, which is anthropometric, so for the assessment, the client frequently consumes fast foods, sweets, and sugar drinks, has a sedentary lifestyle watching K-drama 2 to 3 hours daily, and spends 200 to 300 pesos mostly on snacks. These choices likely lead to excessive calorie intake. For diagnosis, predicted excessive energy intake related to high-calorie food choices as evidenced by frequent fast food, sweets, and sugary beverages. And for the intervention, educate on calorie needs and portion control. Limit fast food to 2 to 3 times a week, and promote healthier snacks, and encourage physical activity 3 to 4 times a week. Set realistic goals and provide low-cost balanced meal examples. For the monitoring and evaluation, maintain normal BMI and reduce fast foods and sugary drinks, improve understanding of calorie balance, increase activity to 20 to 30 minutes a day, and keep weight stable. For nutrition problem number 3, which is the clinical, so for the assessment, we have the client. So the client has impaired chewing due to tooth pain and a recent extraction, skips breakfast, relies on snacks, and prefers sweets and fast foods with low vegetable intake. For the diagnosis, chewing difficulty related to tooth pain and extraction, as evidenced by eating only on the left side and decreased appetite. For the intervention, recommend a soft cold diet such as yogurt, smoothies, mashed foods, and soft rice. Modify texture based on tolerance, encourage slow eating and small frequent meals, and guide on nutrition-rich soft options. For the monitoring and evaluation, goals include consuming greater than or equal to 75% of meals, reduced chewing pain, stable weight at 47 kilograms, improved food variety and tolerance, adherence to soft diet, and gradual improvement in chewing.
Good day, everyone. Today, I will be presenting the dietary computation of our client. Firstly, on our client's data, our client is 19 years old, female with an actual weight of 47 kilograms and a height of 144 centimeters or around 4 feet and 7 inches. In pounds, she weighs around 103.61 pounds and has a small body frame. Her physical activity level corresponds to 35 kilocalories per kilogram of desirable body weight. Now, in computing for our client's desirable body weight using the Tannhauser's method, we convert her height of 4 feet and 7 inches into inches, which gives us around 55 inches. And then converting her height in inches 2 centimeters by 55.2.54, which gives us now 139.7 centimeters. Now we subtract 100, gives us around 39.7, and deduct 10% for Asian or Filipino frame, which gives us now a desirable body weight of 35.73 kilograms or around 78.6 pounds. Now, we compute our client's body mass index using the formula of actual body weight in kilograms divided by height in meters squared. Now, our client's height in meters is now around 1.44 meters, and squaring this gives us around 2.07 meters squared. And placing the data of our client, 47 kilograms divided by 2.07 meters squared, which gives us a BMI of 22.70. Now, according to WHO Body Mass Index classification, our client's BMI falls around the normal range. Next, in computing for our client's total energy requirement using the Harris-Benedict equation for females, we place the data of 655.1 plus 9.563 times our client's weight in kilograms, which is 47, plus 1.850 times 144, which is our client's height in centimeters, minus 4.676 times our client's age in years, which is 19, which gives us a basal energy expenditure of around 1,282.12 kilocalories a day. Now, since our client's activity factor is around 1 and the injury factor is 1, the total energy requirement, or the TER, remains at approximately 1,200 kilocalories a day or per day. Now, in the macronutrient distribution, using the standard percentage distribution for our client's carbohydrate, which gives us now around 1,280 kilocalories times 60%, which gives us equivalent of 768 kilocalories. Then we divide it by 4 for carbohydrates, which gives us around 192 grams. For proteins, it's the same, around 1,280 kilocalories times 15% equals to 192 kilocalories, then divided by 4, which gives us around 48 grams. Then lastly, for fats, we use again the TER of 1,280 kilocalories times 25% equals to 320 kilocalories divided by 9 kilocalories over grams, and which gives us around 35.55 grams or around 35 grams.
For table number 3, this illustrates the translation of the sample menu, and we can see here how we distributed every exchanges into each meals throughout the day. So in this part, this shows how the food exchanges were allocated based on the client's total energy requirement, which is 1,280 kilocalories daily. So for our client, the exchanges were planned to meet nutritional needs while allowing flexibility in food choices and ensuring foods are cold, soft, and easy to consume. So for vegetable exchanges, we included 4 exchange. This is to provide vitamins and minerals needed for healing and are taken in soft or mashed forms. Then for fruit exchanges, we have 5. It is mainly to contribute carbohydrates and vitamin C's and are given in forms of juices, smoothies without seeds. Then for milk exchanges, we included 2. This is to supply protein and calcium support to support tissue and bone healing. And this can be substituted with yogurt or other milk-based drinks. Then for rice, we have 3 exchanges. This serves as the main source of energy and are given off as lugaw or porridge to avoid chewing. Then for meat, we have 2 exchanges. This is to provide protein necessary for wound healing and are substituted with soft protein such as ground meat, fish, eggs, or tofu. Then for fat and sugar exchanges, we have 1 exchange for fat and 4 exchanges for sugar. So this is to help meet the total energy requirement with intake control to avoid irritation of the extraction site. So this allocation of food exchanges ensures adequate energy and nutrients while promoting safe intake and recovery after tooth extraction. So for table number 4, we have here the sample menu. So this is our recommendation for our client. So these foods are nutrient dense, which can aid the client for her fast recovery. So for breakfast, we have here in our sample menu, we recommend a bowl of cold thin squash soup, a glass of cold milk. It can either be plain, chocolate, or soy, and a cup of mashed fruit. It can be banana, avocado, or pears. So for AM snacks, we recommend a glass of chocolate milkshake. Then for lunch, we recommend a bowl of cold potato cream soup, a sliced bread, a glass of mango smoothie, and a cup of mashed fruit. Then for PM snacks, we recommend a cup of cold yogurt with mango puree. Then for dinner, we recommend a bowl of cold chicken and potato arroz caldo and a cup of cold mashed squash with a tablespoon of butter. Then for bedtime snacks, we recommend a glass of cold milk. This case shows that a cold diet plays an important role in nutrition therapy, especially after a tooth extraction, because the extraction site still needs protection from chewing, heat, and irritation. And so it is recommended for a cold diet because it helps address these concerns by providing soft, cool foods that are gentle on the surgical area while still meeting the nutritional needs of the client. So the cooling effect helps reduce swelling and pain. It also provides comfort and protects the blood clot. which helps prevent complications such as dry socket. Soft and texture modified foods also reduce the need for chewing, preventing pressure and trauma to the extraction site. And from a nutritional standpoint, the cold diet helps ensure adequate intake of energy and protein needed for tissue repair. And the sample menu that we provided shows that the foods like milk, yogurt, smoothies, and soft soups can still provide enough protein, vitamins, and minerals without causing discomfort. Fruits rich in vitamin C supports wound healing, and dairy products provide calcium for bone healing. Proper hydration was also recommended and maintained using cold fluids while avoiding the use of straws to protect the extraction site. So this case highlights how nutrition is an important part of post-operative dental care. And for our client, who's a college student living in a dorm, the cold diet was a practical and effective approach that supported healing, prevented complications, and allowed her to continue her academic activities with minimal disruptions. So for patients who have undergone tooth extraction, especially for young adults like our client, following a structured cold diet is highly recommended. So this cold foods helps reduce swelling, bleeding, and pain by naturally constricting the blood vessels, which also protects the blood clot and lowers the risk of dry socket. So in addition to this cold diet, the foods should be soft and easy to eat. So we recommend yogurts, puddings, smoothies, pureed fruits, and blended soup. So this is for minimal chewing and less stress in the surgical site. So this protein, vitamins, and minerals helps the body heal. So including items like milk, soft cheese, protein-rich smoothies, and mashed fruits ensures the body gets what it needs. Also, staying hydrated with cold fluids is also essential. And straws should also be avoided to avoid pressure on the extraction site.